Hello people, we want to look at anti-anginal drugs today, okay? So anti-angina, anti-ischemic drugs we want to look at. First of all, what is angina you should know, okay? So angina pectoris, the full name is angina pectoris. Pectoral, you know what the pectoral area is, right? So angina is the pain, okay, and pectoris, in the pectoris, right? So you can say there is any kind of discomfort in the pectoral region. You can call that as angina pectoris. So what did you understand so far? We are looking at angina pectoris, okay? So look at this. We have seen what angina is. Now let us move on to the types of angina, okay? Now there are three types you can say. Stable or classical, variant or Prince metal type or vasospastic. Then you have unstable angina, UA. Okay. Now what is the stable or classical angina? See, stable angina or classical angina, it's characterized by episodes of chest pain commonly associated with exertion. So if the patient takes rest, then he will become fine. So basically the oxygen demand has increased, and if he takes rest, the oxygen demand comes down and he is able to, the angina is relieved. So basically this angina, you have seen what it is. It is discomfort in the pectoral region, correct? And usually it is because of ischemia, that is low blood supply or low oxygen supply to the heart, myocardium. So when you are saying stable or classical, if the oxygen demand has increased, and that is because of exertion, and if the patient takes rest, if the person is taking rest, then there is no angina. So this is a classical or stable angina, okay? Coming to variant or Prince metal or vasospastic angina. So here what happens, the angina occurs even at rest, and it is due to the spasm of coronary arteries. That's why it is called vasospastic. Even at rest, this can happen. Okay, even at rest. Actually, this can be even in sleep. Okay. Even in sleep, it can happen. Fine, right? So, basically, these are unpredictable. They are due to recurrent coronary vasospasm. They are because of vasospasm. That's why it's called vasospastic. So let us go to unstable angina. Unstable angina also can be at rest, okay? So this is due to rupture of atheromatous plaque. Okay? And here even platelet action will be there. Hold on. So there can be platelet deposition also in this case. Is it clear? Just look at this again. What is angina pectoris? So it is a pain syndrome due to adverse oxygen supply or demand situation in the myocardium. So the metabolites accumulate due to myocardial ischemia. Okay? And there will be pain because of these metabolites that accumulate in myocardium. Okay? Look at this diagram here. In normal, at rest, it will be like this. Okay, the conducting vessel and this is the resistance vessel. So both of them will be able to dilate if there is increased demand, like in exercise. But in classical angina, what happens? Because of an atheroma, the vessel, even if there is no increased flow. Though the demand is more, there is no increased flow. Okay. And coming to variant angina, there is spasm of the vessel. Okay. Now let's move on, guys. Try to understand why there is decreased blood supply, because there is coronary atherosclerosis or there is coronary vasospasm, or there can be coronary thrombosis. So this exertion you can write here, atheroma can be there. Atheroma, okay? That's what they have written here. In classical there is atheroma, in variant there is spasm, okay? So this reduced oxygen supply can be because of coronary atherosclerosis, coronary vasospasm or coronary thrombosis. Why will there be increased oxygen demand? Because of exercise, yeah. Heart rate is more. The contractility of the ventricles could be more. The wall tension, the wall tension could be more, or there could be ventricular hypertrophy. So all these will increase the oxygen demand. Okay. Now, how do you plan on treating an angina? So you have to maintain a balance between the oxygen supply and demand, right? So the balance you have to maintain. You have to either increase the oxygen supply or you have to decrease the demand, right? So the ways to do it, look at that here. Okay. So you can either restore the coronary blood flow to increase the oxygen supply you can do percutaneous intervention. You can do any artery bypass graft. Okay. You can relieve the vasospasm by giving some calcium channel blockers, nitrates. You can break the thrombi using thrombolytic agents like streptokinase, urokinase. Right? You know all these, right? They give it in myocardial infarction to do thrombolysis, streptokinase. Prevent thrombus formation using antiplatelet drugs. So did you understand how to increase the oxygen supply? Either you will do a graft or you will give nitrates, calcium channel blockers. We'll come to the details of those, don't worry. You can also do some streptokinase like that. You can give some thrombolytics. Then last one was what? Antiplatelet drugs. Okay. Then coming to oxygen demand, how will you reduce? You will decrease preload, example with nitrates, we'll come to that. Decrease afterload with calcium channel blockers, potassium channel blockers, etc. Decrease heart rate and contractility by beta adrenergic blockers. We'll come to all the details. I think it has gone a little overhead for you. Quickly, let's revise what we have seen in this video so far. Okay. We looked at what angina pectoris means, right? Then we looked at types of angina. In this, you need to know only two, stable and variant. Stable means stable or classical, variant or princemetal angina or vasospastic. The answer is there only, spasm it is. Classical and stable is like during exertion it can be there because of atheroma. Then this one we will not go into details. Okay, just know these two. Stable and variant you should know. Okay. Don't confuse these two at least. Stable, classical, then you have variant, princemetal or vasospastic. This much you should know. Okay. Then moving on. Oxygen supply can be less because of coronary atherosclerosis, coronary vasospasm, coronary thrombosis. Oxygen demand can be more because of increased heart rate, ventricular hypertrophy, increased ventricular contractility, increased ventricular wall tension. Because of these reasons, oxygen demand can be more. How will you treat angina? In a very overall sense, you have to increase the blood supply or the oxygen supply to the myocardium, or you can decrease the oxygen demand. Okay. Now, these are the drugs for treating angina. It is not difficult. Okay. Come back and we will explain to you. If you want to know just the basics in this video itself, then just hear now itself. So, anti-anginal drugs, you have nitrates. Mainly you should know nitrates and calcium channel blockers. Okay, these two are very important. Nitrates, what they do, they reduce the preload on the heart. So, the load on the heart reduces. How they achieve that? Nitrates by vasodilation, especially the veins. When the veins dilate, there will be pooling of the blood in the veins. So, the preload to the heart will reduce. Okay. However, when it comes to calcium channel blockers, they relax the smooth muscles. So, they reduce afterload. Okay. They have negative chronotropic, dromotropic and inotropic effect. Fine. So, the calcium channels are blocked. So, mainly this is how it works. There are a lot of other things that you can know. Please come back for the next video and we'll explain everything in detail. Okay. Bye-bye.